My name is Takebe from Yokohama City University.
My name is Masaya Shimizu. I work with Dentsu as a sort of strategic planner.
So ALMED is basically a field where the communication experts and medical experts can get together to impact on our healthcare systems to change the people's behaviors to prevent severe diseases.
It's like for something for me, something very basic for me, is something very useful for him. And that's vice versa. Something he take it as granted is something very new to us, and sort of connect that all together. And it really works because we have been doing some experimented initiatives, and that proves to be working. And so that is something we should do. So would that be like cool, just like that people were talking about before us, all that like fun maybe, because we're talking about walking thing at Matsuyama, and what they said was just walk for health. People don't do that. But even if you say, you can walk with your friend, or you can, find something new in your community, people do that. And in the end, they, think about healthcare afterwards, after having all this fun, and they do, whatever these doctors thought they should do, but never do.
So basically, we doctors just say in a very logical manner to persuade the people the risks of their bad behaviors, but people are not behaves in a logical sense, because they need more fun stuffs or exciting stuffs to use. So this is why advertising method is very effective for changing the people's behaviors.
I guess in general, people are speaking very similar thing. I mean, wandering around in one big sphere of something what we will see in the future. And they have all these part of like technologies, a part of advertisement, part of branding, but they'll still we have to sort of tackle that. And knowing all these different informations, that would sort of empower us to build our idea more bigger, and that is probably the same thing to the other people. So to gather all these people who's actually playing is a very, very, very good thing, a big thing, I think.
For our experimental approaches, there are no regulations. Could be issues.
But I think we have to really, fight with those. What sort of boundary you can sort of expand to, and especially, I think the lady who was before us, she was from Google, and saying that he was saying something like try before shrink, because people in the medical industry, to be exact, want to sort of shrink that, and then we as outsiders sort of say something just too freely, and sometimes it touches the people. So you're having all these combinations and trying to find out where the line is, and sort of making the new normal, new basics would be something we have to look for rather than just following all these regulations.